Good afternoon, everyone. We hope you're having a wonderful spring day. So, hello and welcome. And I would like to thank everyone for joining us for this special conversation with Olivia's Light. Olivia's Light is a Virginia-based organization committed to advocating for families navigating the complex and often frustrating journey of rare disease diagnoses, also known as the Diagnostic Odyssey. Today, we are honored to speak with Jenna King. Jenna is the co-founder and president at Olivia's Light, and we just want to welcome you and thank you so much for joining us today.
Thank you. It's such a privilege to share our family story and to promote our conference. So I'm really looking forward to it.
Awesome. So just to get started, can you start us at the beginning? Can you tell us about Olivia's Light and what inspired you to create the organization?
Sure. So I'll just start my presentation now, so I can share some of the slides.
Of course.
And hello to everyone. Sorry I can't see you, but thanks so much for watching.
And while we wait, I will put the Olivia's Light website in the chat so that everyone watching from home can check out her website and learn more about the upcoming conference.
Okay, so yes, we have an upcoming conference, Olivia's Light Pediatric Rare Disease Conference. I think in order for this, the purpose of it to really make sense and why we're doing what we're doing, I will preface this with Olivia's story or our family's story, just so you have an idea of how everything came to be. So this is our little family. That's my husband, Ben, that's Olivia, and that's Luca, my son. And just to open this up, I first want to acknowledge doctors and the nurses community who have supported our family. It's really important for me to put this out there because the way I do approach my advocacy is, if I were to describe it, it's diplomacy meets transparency. We went through a difficult experience. We've had a lot of hard conversations, but with that said, I do feel like it's important to be transparent and be honest about how everything unfolded. But also, I don't want to leave out those who have truly cared for Olivia and cared for our family too. So I just wanted to say that at the top because we were very fortunate to have some special healthcare providers and also just our friends and community who supported us as well. So this is Olivia again, and just to start things off, so I had a seemingly normal pregnancy. I was induced, however, at 37 weeks because Olivia was measuring small. She was in the 1% or first percentile. So that was an emergency induction, and then we thought she was just small and completely fine. But then a few hours after birth, we sent her to the nursery just because it was a long night, wanted some rest. That was the safest place for her to be while my eyes were closed. And as she was in her crib in the nursery, a nurse just happened to be right by her side and saw her turning blue. She described it as seizure-like activity. And then we also noticed that she had a small head. She had abnormal oxygen saturation levels. Her oxygen saturation was dipping into the low 60s. For normal healthy people, it should be about like between 87 and 100. So that was really scary. And then so she was rushed from Martha Jefferson in Charlottesville to VCU. The reason why we didn't go to UVA is because there weren't any beds for us, so we had to go to Richmond. And while we were at, we were at Richmond or VCU, they ran a lot of different labs, 2 EKGs, 2 EEGs, upper airway scope, GI scope, the whole gamut. Even, saw so many different specialists, some who were very reassuring. I remember a nurse practitioner there, 20 years. She looked at Olivia and she said, "Oh, yeah, she'll be discharged in 72 hours." But it just, none of this was really making sense because she was having bradycardia events where her heart rate was just dipping really low. And also her oxygen saturation was unstable. So as parents, it was a very confusing time because there were no answers. All of these labs were coming up normal. The EKG looked fine. The EEG, they couldn't really detect any seizure activity on the scan. And then everything like her heart, her lungs, she looked like a normal baby. But obviously something was truly wrong. So we were at VCU for about 12 days. They did conduct a single panel genetic test because they thought that she may have had this rare disease called congenital central hyperventilation syndrome. Um, that took 4 weeks to get the results back. And then in the meantime, we were just trying to get back home because we lived in Charlottesville at the time. And we just had a feeling like, look, we're not getting answers at VCU. I just have a strong sensation that UVA is where we're going to get the answers that we need. And at this time, like we really, we put our trust in the doctors. We didn't really think, we thought, well, whatever this is serious, but if we can just figure it out, like we can, give her all of the support she needs to get better. So finally a bed opened at UVA and again ran all the different tests, including a swallow study. But still, like now she's 6 weeks old. We still don't have answers. And then child development. There was a nurse that took a special interest in Olivia, and she was really digging for answers, asking a lot of questions. And it's at that point, child development came into the picture. They noticed that her head wasn't growing. So they did an MRI, and on the MRI, it showed delayed myelination. So she basically had the brain or the white matter of a 32-week, I should say, from a gestational standpoint, she was at like 32 weeks. And at this point, she was 6 weeks out of the womb. So we thought initially, well, there's obviously some developmental delay, but we were still being told like, well, she might be able to catch up. And, if we send her home with early intervention, she'd likely grow out of this. But still, as her parents, we were just like, I don't know, because now at this point, she was feeding tube dependent. She was taking like a couple of milliliters of breast milk or formula from her bottle. I just, as a mom, and I had an older son, it just did not seem right. Like, I don't want to take my child home and have this be in an unsafe environment where if she needed additional help with her feeds, and I was out of the hospital setting. So we resisted that and we stayed, in the NICU, and we said that we were not going to leave until we had a diagnosis. So when the MRI results came back, that prompted someone to say, well, what about genetics? And they did run that single panel test, a couple of weeks before, but no one thought she had hyperventilation syndrome. So they did a broad genetic test called whole exome sequencing. And a couple of days later, there was a genetic cause that was found. And I'll talk about that in a moment. But I just want to highlight, like, in this, any family out there who has is going through this diagnostic odyssey on, or yourselves, you understand when I say that time, like in the unknown and just waiting in agony, and asking yourself questions like, did I do something wrong? And then, just not having those answers, not having a diagnosis, also built a lot of tension between myself, my husband, and our providers. When we got to UVA, for instance, they immediately started talking about like the discharge plan, how to get her out of there, and just, she'll stay a night or two and then she's going to go home. And I remember stepping up and saying like, wait a minute, never mind the discharge plan. What about the diagnostic plan? What about figuring out what is wrong with my child? Why is she turning blue? Why can't she breathe on her own? Why can't she feed on her own? Like, let's come up with answers to these questions. And I think that 6 weeks is a kind of a long time to spend in intensive care. And like, let's face it, like she was, taking up a bed. So I think that not having answers, they just kind of felt sick. Well, we can't really do anything more for her here. And, I would get questions like, what can we do to make you feel okay bringing her home? And then there were times, still like within this period of the unknown, saying to a doctor, well, why is her saturation levels at 80? And then they would say something like, well, maybe she has reflux. And I would ask, why is there discoloration around her lips? Why is her face blue? Oh, like it might be the lighting. And, again, like not having a clinical background myself, all we could really say, like as your child's advocate, is this is just not good enough. And I think part of what I do and what with Olivia's Light is I often think of parents who are not able to attend, their child's bedside every day. Maybe they live 2 hours, outside of Charlottesville or the city, and they don't have this immediate access to the hospital like we did. We lived right in town. So then, part 2 of Olivia's story is, receiving a call from my daughter's geneticist, Christina Peruca at UVA, who is fantastic. As soon as she came into the picture, we got answers. And she let us know it was every parent's worst nightmare, but Olivia had a condition called EEF 1A2 related neurodevelopmental disorder. And basically, she was producing toxic proteins, and it impacted everything, movement, just how her brain function. Her brain basically wasn't telling her body to breathe. Her prognosis, there are many different variants of this condition. There's actually a pretty large spectrum, and she was at the most severe end of the spectrum. But she would be nonverbal, non-ambulatory. We were already seeing signs of epilepsy. Eventually, she would be autistic. Eventually, she would lose her eyesight, and possibly her hearing. And then when I received this call, I was actually in the hospital right next to Olivia, and I remember thinking, like, looking at her, just not so much sorry for myself at all, but just feeling kind of helpless in the way that, like, well, now what? I just knew that the way that people would even look at her would change, right? They would start to label her as disabled or incapable. And as a mom, that just, broke my heart. And I just, made a promise to myself right then, like knowing my daughter would never be able to speak for herself. We also didn't know the life expectancy at this point. But knowing she would never be able to speak at this point, I felt like it was now my job to advocate for her, and for children like her, and for families like ours. And that was when really what sparked the idea to establish Olivia's Light. So with a lethal diagnosis, some people might say like, well, they're going to die anyways. What's the point of a diagnosis? But there are true benefits of having answers. First of all, it immediately changed the way Olivia was perceived and treated. Finally, it was like she was understood. They were no longer trying to like kick us out of the hospital, but it was like, okay, well, now you guys, like, whatever you need, we're here for you, like rolling out the red carpet. Truly an amazing response from UVA. And, now we no longer had to convince providers that something was wrong, and we were working together as a team because we all were on the same page, and we were able to give her the support that she needed. And as parents and providers, we were able to make informed, confident decisions instead of guessing the diagnosis and, guessing whether she needs a feeding tube or a G tube or other, interventions. We now could confidently make those decisions. And then we had access to high level support. We were then connected to other EF1A2 families, and we could see, like, what are you guys doing for, are you using certain medications for pain management or, for seizures? Also, she immediately qualified for Medicaid waivers. So we had all medical equipment, skilled nurse, at-home nursing, which saved us from financial devastation. She qualified for palliative care, and they were great once we finally made the transition to home. And then eventually, Olivia she was on the decline and qualified for hospice. So this is just part 4, and, just wrapping things up. Finally, we're able to take Olivia home for 7 weeks, where we loved on her, integrated her into our daily lives. This is not quite like the COVID era, but sort of like, maybe like a year after. So her brother Luca wasn't able to meet her yet. So he finally, got to meet his baby sister. And, maybe like a month after Olivia came home, we saw her, she continued to have these blue spells more and more often. And hospice came in the picture, and we were just, preparing ourselves for what was to come, realizing that even though there was no like life expectancy determined, but we knew that the time was soon. And we were in a position where we were able to just support her to the best of our abilities. And then just like when the day that Olivia did pass away, I just think back to it, and as I reflect on it, just knowing why this happened. I mean, I just can't imagine like the way everything unfolded, just being her mom. And so basically that day, like, she passed from respiratory failure. She had a bunch of seizures. And just as her mother, like, if that was not explained to me, I don't know how I would live with myself, honestly. I think just that event, that day, would have been chaos, like calling emergency and having, police and EMT and fire trucks, and just, because we didn't know what was going on. But because we had a diagnosis, we knew that, okay, this was expected, and it was more controlled, more dignified, and truly, she did pass away peacefully. And then, this leads us to Olivia's legacy, Olivia's light. Also, Olivia's condition was spontaneous. It was a spontaneous mutation. It was not inherited. Because we knew that, we had the confidence to continue to grow our family. Up in the right, upper right corner is Holly. That was Holly, just a few months old, but now she's a year and a half. She's healthy. She's thriving. We're totally in love with her. And then, it paved the way also for the Olivia's Light Pediatric Rare Disease Conference. And just, final comments, like thinking back to like what I would want to see just from our story is help end the diagnostic odyssey for patients by utilizing whole exome or whole genome sequencing as a first diagnostic tool, right? Like, so if you're a heart patient or a lung patient, or if you have an infection, why is it that, this kind of testing is done automatically, right? It's a first tier diagnostic tool when you go to the hospital. But if you have a genetic condition, then why is that not a first tier diagnostic tool? And it should be the standard of care. And also as an outpatient, if there are patients with autism and epilepsy and cerebral palsy who might not know why, or the cause of it. And it's not always genetic, but still, as a parent, I would want to know if there was a genetic cause. And I just named a bit of benefits as to why that would be. And I know that, 6 weeks, it doesn't necessarily sound like a long time compared to patients or, children or young adults or adults who have done, have been living in the unknown for literally decades. But it used to be an excuse that, when technology didn't exist, like, okay, it's the excuse that there was no way to do this, to find out the answers, but it's not an excuse anymore. Having a medically complex child, having a child with a rare disease, you're pretty much like, this is a whole new blueprint. And that's so complicated, and just live that kind of lifestyle and taking care of your child and just living a life as a family is super complicated. The diagnosis needs to be the easy part. And it's a 30-second buccal swab, buccal swab, or a blood test. It's fast, they're rapid, you can get results back in like 3 to 5 days now. And the last thing I want to see is, larger genetics teams and more subspecialists conducting exome and genome sequencing. Waitlists are way too long. If you have a child with autism or epilepsy, cerebral palsy, you know what I mean by this. You're waiting, a year and a half to see a developmental pediatrician and neurologist, and then just to hear them say, oh, well, now, we're going to refer you to genetics, but then it's a year-long wait list for that too. So having subspecialists conduct these tests allows for, equity and accessibility to the testing. So that brings us to the conference. Parents and advocates are welcome. I will say that this is a real medical conference where doctors we're offering doctors C credits. We have a whole planning committee. I'm one of the course directors alongside a neonatologist at UVA, David Kaufman. He was Olivia's former primary attending doctor, know him really well. And, how this really came about is when I circled back to a neonatologist at VCU, I had asked her point blank, why did you guys run that single panel test? Why, did you not go with the whole exome sequencing? Because that wasted a ton of time. And her answer was, to be honest with you, I just had no idea that the test existed. And I truly appreciate her transparency, because it made me realize that there is a need for additional education. There's a lack of awareness here. So we created this whole conference. We have guest faculty we have faculty from UVA, also have guest faculty from Nemours Children's Hospital, Nationwide Children's Hospital, Wake Forest, Duke, Cincinnati Children's, UNC Chapel Hill. This is an all-star cast of experts within rare disease, and we have a whole planning committee with UVA and CHKD faculty, as well as VCU faculty as well. And then here is just a rundown of our agenda. Our keynote speaker is a neonatologist and geneticist out of Nationwide Children's, Bimal Chowdhury. He's exceptional. We have a geneticist from Duke who's talking about, rapid exome and genome, which I have continued to reference throughout this presentation. But we also have a developmental pediatrician coming to talk, a clinical psychiatrist that's coming to talk, and another neonatologist. And this is, there's an emphasis on genetic testing. However, as it's a rare disease conference, we are really hitting on different components of the rare disease journey. So expanding the access to testing, but also community outreach and how to increase access to care for individuals with a rare disease, prenatal and neonatal red flags. So, and also we're covering ethics and communication and therapies as well. So thank you. And I don't know if I'll leave this up for a second if you wanted to click the little QR code in the bottom right, but that's it in a nutshell. Does anyone have any questions? Or I'm sorry, what's next? Am I taking questions?
Of course, you can take as many questions as you like. And I just dropped the link, the registration link to
Okay.
the conference in the chat.
Okay. Is it okay if I stop sharing my screen?
Yes, let me remove it for you. There you go. I do have a few follow-up questions. So, how can families or individuals reach out to Olivia's Light for support?
Sorry, you're breaking up a little bit. Is how can they reach out to Olivia's Light for start?
Yes.
You can email me, jenna.king@oliviaslight.org if you have specific questions, whether it's about doctors or how to access certain doctors. You can come to the conference, and there's a networking reception at the end of day one, and that's really the idea of that is let's have conversations with providers and share your own experience with them and ask them tap into different resources. But you can also email me, reach out to me with whatever questions that you have, and I'll do my best to support you and answer those questions.
Wonderful. So I know you just mentioned, um, a bit about community involvement at the conference. So I wanted to know, how can people get involved with Olivia's Light after the conference or even now before the conference?
Well, right now we're, making a big push to get doctors there. So, I'm not sure what the, families who are on this call, what their background are. But say if, you have a child with epilepsy or autism, cerebral palsy, or you just suspect your child has a genetic condition, or maybe your child has a genetic condition. I think the biggest way that you can help us right now is talk to your doctors and try to get them to this conference. We are trying to change the standard of care. We are trying to raise the bar. And really, the only way to do that right now, before it will eventually, I think it will take a whole institutional change truly, but to make a change right now is to educate doctors. And I think neurologists and developmental pediatricians especially are the hardest people to get there, and they're the ones that truly have to hear this message. So if you can reach out to your doctors, that would be a huge help. And then as far as like after the conference, we do fundraising. So right now we're fundraising. Um, we're uh, we're fundraising to fund. Sorry, we're fundraising for UVA Health Children's palliative care program for children who are impacted by a rare disease. Our goal is $100,000. We're halfway to goal. So we are going to come up with different ways, to come up with the remaining 50,000, and then our our nonprofit is just a couple of years old, and I would love to hear from different parents if you have ideas of how Olivia's Light can impact your child or children. Just depending on what your backstory is, I'm completely open to ideas and any feedback.
Yes, and then if you all would like to share any of your ideas with her or feedback, you can always email her, and I will drop the Gmail account in the chat for you all. You can also find on her website as well. So before we wrap up today, is there anything else that you would like to share with our audience today?
I I mean, I wish I knew who. I sorry I can't see you all. I wish I knew who was out there. I just hope that my daughter, she passed away, but my personal fight, it just didn't feel like it was over, and I felt like with all of the information that I had learned and all of the education that I acquired from that experience, it was so hard to walk away from it all, like it never happened. So I hope that I can just offer hope for, your child and your family, with answers. I think it can make a big difference. Also, Olivia, sure, she did have a life-threatening illness, but in some cases, maybe it's not that way. Maybe it could be a diagnosis could be life-saving. Maybe diagnosis can mean that with early intervention, your child could live a fuller life with that's high quality. And if not, perhaps just, a dignified life. And also just stepping up, when you can, for this, I think this population that is oftentimes unseen, underappreciated, underrepresented, and that's really why I'm doing what I'm doing, is because I feel like if I'm not going to share my story, if I'm not going to step, then who is? So perhaps if nothing else, it motivates you or inspires you to share your child's story. Um, yeah, and we could all make a difference. So.
Thank you so much, Jenna, for sharing your time and your heart with us. And thank you to Olivia's Light for being a beacon of hope for so many. We definitely look forward to your conference, and we hope that you have an amazing turnout and definitely help our providers and our families. And I would like to say to our viewers, if you want to learn more or get involved or even share your story, be sure to follow Olivia's Light on Facebook and Instagram, and visit her website. And if you would like to share your story with us on our platform, you're free to email us or, of course, send us a message. And together we can definitely end the diagnostic odyssey and provide more families with hope. Thank you so much, Jenna.
Thank you. Bye, everyone.
Bye.